So one of the major symptoms of diabetes mellitus is blindness, and this has two major pathophysiological contributors. Firstly, you're going to have blood vessel glycation. This results in atherosclerosis and arteriosclerosis, which leads to decreased blood flow to the eye and to the optic nerve, and this will lead to blindness. Secondly, you're going to have cataract formation. So with diabetes mellitus, you're obviously going to have a high concentration of glucose in the blood. This is going to result in increased uptake of glucose by the lens itself. Now, all this glucose in the lens is going to saturate the normal pathway of glucose phosphorylation. It's going to saturate specifically the hexokinase enzyme. And if this is saturated, instead of normal glucose phosphorylation, you're going to instead have glucose reduction to sorbitol. Sorbitol attracts water very, very strongly, and you're going to have a resultant lens edema. And the lens edema is going to result in hydropic degeneration of the lens fibers. And these two things together will contribute to blindness. One of the major features of diabetes mellitus is poor wound healing and secondary bacterial infection, and this is due to a couple of things. Firstly, we're going to have blood vessel glycation, which leads to ischemia. If you have ischemia of an existing wound, then you're going to have impaired healing due to decreased transport of nutrients to the area. You're going to have hypoxia, and you're going to have decreased transport of immune cells to the area for decreased clearance of dead and damaged tissue. In addition to that, the high glucose concentration in the blood is going to result in increased bacterial activity at the wound site, and you're also going to have impaired neutrophil function.